Hey everyone, and welcome. Today, we're diving into a condition that starts with something super common, a little cut or a scratch. But this simple injury can hide a really surprising medical secret, especially if you work in certain jobs.
Think about it. You're prepping dinner, maybe you're at your job handling fish or meat, and you get a tiny little cut. What's the worst that could happen, right? Well, what if that tiny injury could lead to a very distinct and, honestly, kind of tricky infection to diagnose? Let's get into it.
All right, so here's our game plan. We'll kick things off by figuring out what Erysipeloid actually is. Then we'll track down the source of the infection and learn how to spot the symptoms. After that, we'll look at how doctors diagnose it, cover the super important treatment details, and wrap it all up with the key takeaways you absolutely need to remember.
Okay, first things first. What in the world are we even talking about here? The best way to think about Erysipeloid is as an occupational hazard. Yep, an infection that's directly tied to what people do for a living.
So in simple terms, erysipeloid is a skin infection. It's caused by this specific type of bacteria, and it almost always gets into your body through a break in the skin. You know, a cut, a scrape, something like that, which happens while you're handling animal products.
This naturally leads to the question, who really needs to pay attention to this? Well, we're talking about butchers, folks working in slaughterhouses, fishermen, people handling shellfish, and veterinarians. Basically, anyone whose job puts them in direct contact with raw animal stuff, carcasses, bones, you name it. For most people, this is pretty rare, but if you're in one of these professions, it's a risk you should definitely know about.
Okay, so now let's put on our detective hats and zoom in on what's actually causing all this trouble. It's time to meet the microscopic culprit behind Erysipeloid.
The bug responsible is called Erysipelothrix rhusiopathiae. Yeah, it's a real mouthful, I know. But the main thing you need to get is that this little guy is everywhere. It's found all over the world, hanging out on decaying stuff and in a whole bunch of animals. We're talking everything from fish and shellfish to pigs and birds.
So, what makes this bacterium so good at causing an infection? Well, it's got this awesome little survival toolkit. It has a capsule that acts like a protective shield against our immune system. It's got these special adhesion proteins that are like superglue, helping it stick to our cells. And it even has enzymes that let it spread through our tissues. The bottom line is, once it gets past your skin, it's a pretty tough opponent.
All right, so the bacteria has breached the defenses. What happens next? Let's take a look at how this infection evolves, going from just a small wound to a very specific telltale rash. So here's how it usually plays out. After that initial cut or puncture, it can take up to a week for the first real signs to appear. And the classic sign is this really unique rash. It's raised up from the skin, it's firm, and it has this distinct purplish, almost violet color. From there, the rash might slowly start to expand over the next couple of weeks, and it can be pretty uncomfortable with a lot of itching and burning. Now, the infection can show up in a couple of different ways. By far, the most common form is what we call localized cutaneous. It's just right there on the skin in one spot. But, and this is important, in some really rare cases, the bacteria can actually get into the bloodstream, and that is way more serious. It can lead to infections in your joints, or even worse, an infection of your heart valves, which is a condition called endocarditis. This brings us to the diagnosis part. Because this rash can sometimes look like other skin problems, figuring out that it's Erysipeloid is kind of like solving a medical mystery. It takes some very specific clues.
And believe it or not, the single most important clue is your story. Telling your doctor, hey, I'm a butcher, or I was handling fish last week, is absolutely crucial. To actually confirm the diagnosis, the doctor needs to take what's called a full-thickness skin biopsy. They have to go deep because that's where the bacteria lives. They culture that sample to grow the bug. There are also faster PCR tests that can nail it down.
And here's exactly why that special testing is so key. The bacteria almost never shows up in a standard blood test if it's just a skin infection. Plus, under a microscope, it can easily be mistaken for other common bacteria. So you can see why that biopsy and, again, your personal history are the keys to cracking the case.
Okay, so once the mystery is solved and we have a diagnosis, what's the road to recovery look like? Well, the good news is Erysipeloid is totally treatable with antibiotics. But there is one extremely important warning that everyone needs to know about. All right, lean in for this one, because this is the big reveal. This bacteria is naturally resistant to vancomycin. This is a huge, huge deal. Why? Because vancomycin is a really powerful, common antibiotic that doctors often reach for when they see a serious skin infection. But for Erysipeloid, it would be completely useless. It just won't work.
So, if vancomycin is out, what's in? Well, as you can see here, this little bacterium is actually very sensitive to good old-fashioned penicillin and similar antibiotics like amoxicillin. For a simple skin infection, a 7 to 10 day course usually does the trick. For those more severe, systemic cases we talked about, that's when you need IV antibiotics, and for a longer time.
Wow, we have covered a ton of ground. So let's take a minute to boil it all down and recap the most important takeaways you should lock in.
First, remember this is an occupational hazard, tied directly to handling animal products. Second, be on the lookout for that very distinct raised purplish rash after a cut. Third, the good news. It's treatable with simple antibiotics like penicillin. Fourth, and this is the big one, it is resistant to vancomycin. And finally, please always tell your doctor about your job or what you've been exposed to. It can make all the difference in getting the right diagnosis quickly.
You know, it really gets you thinking, doesn't it? Learning about a specific risk like this one kind of opens up a bigger question. What other hidden dangers might be lurking in the everyday jobs that people do all around us?
Hey, if you found this explainer useful and learned something new, do us a favor and hit that like button. Share it with anyone you think might need to see this. And of course, subscribe to MediByte for more medical knowledge made clear. Thanks so much for watching.